Hello! In this video, we're going to go through the process of admitting a patient to the PICU. This is the order set we're going to use. I recommend adding it to your favorites now, so you'll be ready to go when it's time to admit your first ICU patient. Now I'm going to switch over to the Epic Playground so I can walk you through using the order set. Alright, here we are. First, you likely recognize this as the Admission tab. I'm sure you're more than capable of working through this navigator without my guidance, but I want to draw your attention to one item in particular, the admit and dosing weight. Entering a weight here will save a lot of chaos and annoyance in the future. The admit or dosing weight is the default weight for all medications that get ordered for a patient, including the continuous infusions. Our patients' weights often vary dramatically from day to day due to changes in fluid status, and if there's no dosing weight, drip orders will usually just reflect the measured weight from whatever day the order was placed. This can result in pumps programmed to many, potentially very different weights. At best, this is frustrating. At worst, it could have dangerous consequences for the patient. So please take a second to enter the weight that the nurses obtained when the patient arrived on the unit. If the patient was too sick to weigh, it's fine to use a reported weight from the ED or referring facility. If this gets missed on admission, you can update it later by coming back to the Admission tab and changing it in the way I just showed you here. Now let's move on to that order set. If you saved it to your favorites, you can access it easily from that list. If not, you can search the order sets and find it there. When you open the order set, you will see that many orders are already selected for you. You should obviously check and be sure that these orders are appropriate for your patient, but for the most part, they reflect our unit routine and you won't have to change anything. The first order that does require input from you is the line/IV order. Most of our patients arrive with some form of access or will be getting some very soon after arrival. Select the appropriate type of access for your patient and click the Insert/Maintain box. The next red exclamation point is next to the total fluid goal order. As the name suggests, this order tells the bedside nurse how much total fluid you want your patient to receive each hour. This target will vary depending on your patient's size, condition, and underlying physiology, but often is approximately the maintenance fluid rate. For now, let's use 75 cc's per hour, which is approximately maintenance for our 36 kilo patient. For the sake of time, I won't go through every single option in this order set, but one that comes up frequently is the GI tube insert/care order. If your patient already has an NG, or you know you're going to intubate and will need to place one to decompress the stomach, select this order. The default settings are generally appropriate. If you already know that you want to place a TP tube for transpyloric feeds, you can also do that here and select the nasointestinal option, but usually that decision is made later in the admission. If you know whether or not your patient will be allowed to eat, you can select the appropriate diet order from within this order set. If you're admitting an infant, go ahead and unselect this heel protector boots order. We don't have them that small. The next exclamation point is at the oximetry order. Enter the appropriate saturation target for your patient. In most non-cardiac kids, we want to keep the sats above 90%. For intubated patients, you will also want to place a capnometry order. For patients on a ventilator, we use the inline device. The default parameters are usually appropriate, but if the kid has chronic CO2 retention, you may need to raise the high limit. Enter your call parameters, which infuriatingly are in the opposite order of the alarm limits you just entered, and go ahead and accept the order. If your patient is on non-invasive ventilation, you can select the appropriate option from within this section here. Now let's say our patient was intubated prior to arrival. You will need to select ventilator orders, which you can do here. When you check that box, the State Behavior Scale or SBS order pops up. All intubated patients need to have an active SBS order, so we'll go ahead and complete that now. In most cases, -1 is an appropriate place to start. A -1 means the patient is sedated but will wake up and respond to your exam or if you talk to them. If the patient is unstable, you may not want them to wake up to these stimuli, in which case a -2 would probably be reasonable. I generally don't select -3 unless I want the patient completely sedated and paralyzed, with no response at all to external stimuli. For what it's worth, some kids do perfectly fine being awake with a breathing tube in which case a 0 would be appropriate. Once you've completed that order, you can go back and finish the vent orders. All ventilated patients get eye ointment since they are generally sedated and not blinking. The default options already in place are fine. Now, onto the ventilator mode itself. We usually place our patients on SIMV PRVC plus pressure support. Be sure you are selecting the option that includes pressure support, not the one farther up on the list. We talk more about PRVC and the appropriate settings in another video, but you should be able to get the information you need for this order from looking at the ventilator. If you still have any questions, ask your fellow or the RT caring for your patient. Moving past the rest of the respiratory orders brings us to the medication section. There are a number of general medications you can order here, including various forms of Tylenol. You can also order GI prophylaxis in this section, but please don't do that unless you have a specific indication. If your patient has a central line or an arterial line, you will need to run fluids to keep it open. Unfortunately, our line fluids have changed and the orders have not yet been updated within this order set. I will work on fixing that with the Epic folks, but in the meantime, please use the separate monitoring lines order set instead. This section is also where you can select IV fluids. Fluid selection is a whole topic in itself, but let's say that you've talked to your fellow and decided to go with D5NS for this patient. In our unit, fluids are the only infusions that can be ordered with a range. Nurses can't titrate pressors or sedation like they can in the ED or adult units. If you just want to keep the line patent, enter a range of 0 to 3 cc's an hour. If you want to actually run fluids, put in a range of 1 to your maximum total fluid goal to allow the nurse to adjust the rate to account for any other infusions that the patient may be receiving. Next up, lab orders. If you happen to want Q4-hour PICU labs, you can order them here very easily. If you happen to want a different frequency or don't have, say, an arterial line, it's probably easier to order your recurring labs separately using the acute lab orders panel. The admission lab section also includes some other one-time labs you might want to send when the patient arrives, but you can obviously also just add anything else you may want outside of the order set. If your patient arrived with an ET tube, order a chest x-ray to confirm tube position. It's good practice to get a new x-ray anytime an intubated patient travels, as tubes can easily move out of ideal position when the patient is being transported. Select the portable chest x-ray order, click the appropriate options to indicate that the patient is in the ICU and the study will be portable, and of course, enter a quick summary of your patient and what you hope to learn from the imaging. We've now made it to the last section in the order set, the consult section. If you don't have a specific skin concern, you can deselect the woundostomy nurse consult, but please leave the PT and OT orders, as these services should be involved for all of our patients in the ICU. With that, you can sign your orders and you're done. Hopefully that's helped you prepare for admitting your first PICU patient. Thanks for watching.